Hi and welcome to Genetics Decoded. I'm your host, Sharon Palmer. Please note that the information being presented here is not for medical advice. It really is just to help you better understand your health and make better decisions. If you enjoy the podcast, please remember to go in and like and subscribe. Today we're going to have a really deep look at celiac disease and specifically around the genetics of celiac disease. So if you've been diagnosed yourself or you've got a family member that's been diagnosed with celiac disease, then I would encourage you to stay tuned. Also, if you've been diagnosed with any autoimmune disease or have autoimmune disease in your family, you're going to really want to listen as well, because what we're seeing is this problem with being gluten intolerant, having an abnormal response to gluten in your diet, is what leads to celiac disease, as well as a whole range of other autoimmune conditions. We can go in and very clearly identify who is reacting abnormally and then make much better clinical decisions as we remove gluten, making sure that we're supporting and keeping our gut microbiome healthy in the process. Today, the focus is going to be on celiac disease. I don't know, perhaps you've been diagnosed with celiac disease yourself. Perhaps there's someone in your family that has celiac disease. It is a really serious autoimmune condition. So let's start by going, what is celiac disease? I always assume people have heard it and they know what it is, but let's have a look at what it is. So celiac disease, it's an autoimmune disease, and it occurs in people who have this abnormal response to gluten. So gluten is found in, breads and pastas. And in some people, they don't have a normal reaction to it, and it ends up leading to the production of these autoimmune antibodies. And in celiac disease, those autoimmune antibodies begin to destroy the little cilia, kind of these little hair-like projections in the small intestines, begins to destroy them, and it starts to really interfere with the body's ability to absorb a lot of nutrients. And in fact, a lot of people end up being diagnosed with celiac disease because they may be having issues with like really low iron over a period of time, or their vitamin D levels are not good, and someone thinks, oh, maybe there's a problem here, and they go in and they do a celiac antibody screen. So that's often how a lot of people first get diagnosed with it. But it's an autoimmune condition, and it really impacts around the small intestines and leads to a lot of problems around nutrient absorption. A lot of people can have very obvious gut issues, so a lot of pain and cramping, diarrhea, constipation, but severity of symptoms doesn't always indicate whether you do or don't have celiac disease. I've seen patients with quite mild symptoms over time that we end up finding out they've got celiac disease, but then I also see people that have got really severe symptoms, but they don't have active celiac disease. So the severity of your symptoms does not always mean you will or you won't have it. And again, we'll talk about ways in which you can go in and look at that. From a prevalence point of view, like how common is it to have celiac disease? 1 in 100 people have celiac disease, which I think is a pretty high number. 1 in 100 is quite high. We see the highest rates in young children and in women. But when we look at, 1 in 100 people having celiac disease, the ability to diagnose it is still really, really poor. So only about 30% of people with celiac disease get a diagnosis. And this is what I'm starting to see at a clinic level. One of the programs we have is something called a gut and immune rebalancing program. Of all the programs we offer, more people register for that program than any other. So there's a lot of issues around gut in people in society. They've been struggling for years to get some insight and to get some kind of improvement or resolution. And recently in clinic, I saw this man. He was 49 years of age. He's had long-term gut problems, like very severe. He's been seeing his GP. He's been getting kind of no improvement. And it got to the point where his GP said, well, I kind of think it's all in your head and we should refer you out to a psychiatrist, which he was not happy about. And it was kind of one of the reasons that we ended up seeing him at iDNA Health. He just wanted to try and get some insight into what's going on. What we did is we did the gut and the immune rebalancing program, and one of the things we screen in that program is whether somebody is gluten intolerant or not. And his genetics came back saying he was gluten intolerant. We then thought, well, okay, we know that if you're gluten intolerant, there's a risk of celiac disease, plus a range of other autoimmune diseases. So we gave him a list of pathology tests to do, which he took back to his GP, and his GP was actually very willing to do them. And I saw him last week, and he came into my clinic room and he was so angry. He had his pathology results, he had them in his hand, and he literally threw them down on my desk. And he goes, look at that. And so we went through his pathology, and he had active celiac disease. He had other autoimmune markers that were raised that are tied into lupus. He had a lot of things going on, and he was so incredibly angry because he just felt that he's been trying for so long to get some insight. He's been kind of dismissed. He hasn't seen any improvement. And then he finds out he's got these really serious autoimmune conditions. And he's like, how did this happen? And I see that a lot. And it's just because we're just not having maybe a good understanding of just what sits behind some of these gut issues. And that can be the real power of genetics, is you can go in and look at some of this clinical risk. And, what's really interesting is that, as soon as we advised him to remove gluten, he did. And he's like, oh, for the first time, like my gut pain has gone. And then he was preparing a meal for his daughter, and he was cutting it up on a cutting board and had gluten in it, and he just reused it. He said within 2 hours, all of that gut pain came back. So he really clearly sees this interaction here. But it shouldn't be that somebody is taking years to get that kind of diagnosis. I also had another patient, a 7-year-old girl, lots and lots of gut issues, lots of eczema, like terrible eczema on her skin, lots of not doing well at school, not being able to focus. And again, her GP had referred her to a specialist. And through all of that, the final recommendation was to change her washing powder, and that should maybe make a difference to her eczema. And again, the mum was just very unhappy with that advice. The changing the washing powder didn't help. And again, we went through this process of looking at the genetics, the same thing. We saw that she had a really significant marker for being gluten intolerant, like very little gluten would trigger an immune response. And we then got her to do a celiac antibody screen, and she was right on the border. So when you look at a celiac antibody test, you kind of got 3 options. You will be told that it's negative, there's no celiac antibodies, or you'll be told that it's positive. And there's this bit in between where it's like, we're not quite sure. And she was right on the cusp. I think her reading was 8, and if it had been 9, she would have been told she had celiac disease. Now, her GP looked at that and said, oh, you don't have celiac disease and there's nothing you need to do. And when we look at that from a genetic point of view, we look and go, we know that you're gluten intolerant. There's a very high risk of you throwing off celiac antibodies and developing celiac disease. Let's look to see what's happened. Oh, you're right on the cusp. It is critical that right now you absolutely get rid of gluten. We need to see that trigger begin to drop. And that's what the mum did. She took her off gluten, and we've tracked those celiac antibodies, and they're now down to within normal range. But at the same time, the gut issues, the skin issues have all improved as well. So again, we've got to get better at this process of when people come in with symptoms, is what's sitting behind that. And then I also had another young patient whose mother said the minute they introduced solid food, so this is around about the age of 6 months, the child just had persistent diarrhea, just day in and day out. He was now a couple of years old. They had ended up being referred through to a gastroenterologist who had done some genetic testing, which I thought was remarkable. They'd gone in and looked to see whether they had some of these gluten intolerance mutations, and they were positive. They came back and they had some of these genetic risk factors. And I said to the mum, okay, so you've been advised to remove gluten and gluten has gone out of the diet. And she said, oh no, we didn't get told to remove gluten. We were just told that there was a risk, and when he developed celiac disease, if and when, just bring him back and we would treat him. And I go, again, here was this opportunity. And as soon as I said to the mum, no, that test means that you need to remove gluten, they removed gluten, and for the first time, that diarrhea began to settle. So there are better ways out there for us to be investigating around things like gluten and risk of celiac disease, but we all have to get better at really understanding the interpretation of some of these tests and one of the interventions, because if we miss it and we get it wrong, patients don't get better, or at the point where, things are not quite as bad as they could be and we miss that opportunity to settle it down, then, down the track, it's like, well, now you've got celiac disease. And, I'm still seeing people in their 40s and 50s who are getting a diagnosis of celiac disease. I've got patients of 4 who've already got it. But it's not that you just suddenly become intolerant to gluten. We now know from a genetic point of view that there are some people who have this abnormal response to gluten. So as we're saying, the reason people get celiac disease is because of this abnormal response. And so the question is, well, if some people have that abnormal response, how do I figure out if that is me? Well, that is so easy to do today. You can just go in and you can screen the genetics, and then if you do have these gluten intolerant risk factors, you remove it. And in fact, what we're seeing from the research is the earlier you find out, the better, and the earlier you remove it, the better. What you want to do is not wait until you get diagnosed with celiac disease. You want to understand what one of the drivers is and deal with it really, really early. The incidence of celiac disease is increasing over time, and that is not because we're seeing an increased rate of mutation in these genes. That kind of mutation in genes happens over thousands of years. The incidence of celiac disease is increasing 7% per year over the last number of decades. So that's quite a significant increase. And it has everything to do with our dietary choices. We are seeing food manufacturers now who are putting gluten in so many products. So we're seeing this increased exposure. We're also seeing more of an adoption of this Western style diet, lots of carbs, lots of breads, lots of pastas. People are eating so much ultra processed food these days. I've been hearing statistics recently that in the US, 60 to 70% of food is being consumed in the form of ultra processed food. And again, there's a much higher chance that gluten has been used for whatever properties it's being used for in a lot of these foods. So people are just being exposed a whole lot more. So we're seeing this incidence increase because our dietary choices and food manufacturers are just simply putting it in everything. If you can screen around your risk of celiac from a genetic point of view, how do you do that? If you're interested in going down that pathway, what would you need to do? And there are a lot of companies out there right now who are putting genetic testing into the market who do report on a couple of the genes around the risk of developing celiac disease. The thing is, there's a lot of confusion out there right now. There's a lot of messy terminology, people not really clear around what they're doing, and it starts to get a little bit murky. If we look at things from a genetic perspective, the research has identified a number of genes that tell you that you would have an abnormal response to gluten. The problem is when these genetic companies report that genetic data, they often refer to these as celiac genes. So there'll be like a little heading, your risk of celiac disease. And if you've got, and they usually screen 2 genes, and those 2 genes are important. They're what we call your HLA genes, your HLA DQ2.5 and HLA DQ8. So these are the 2 main genes that are screened, but we should stop calling them celiac genes. If you have mutations in those 2 genes, it's not just celiac disease that you may be at increased risk of. You could be at increased risk of a whole range of other autoimmune conditions, such as Hashimoto's and type 1 diabetes and pernicious anemia, and the list just goes on and on. So, what I often see is people get that genetic data, they look and they go, oh, I've got an increased risk of celiac disease. I don't have celiac disease. There's no one in my family that has celiac disease. Oh, okay, I'll just ignore it. Whereas what that should say is that you have an abnormal reaction to gluten. You're gluten intolerant. And that means that somebody would take a completely different action based on that information, not dismiss it like I don't have celiac disease. Oh, I'm reacting abnormally to gluten, and what I should be doing is removing gluten. So again, we come back to the data, the information is there, but the understanding and the interpretation of that data can be a lot gets lost in translation here. And in fact, we shouldn't be referring to it as gluten intolerance. If we're really getting technical here, we should be calling it gluten allergy. So the difference between a food intolerance and an allergy is where you get this immune response. And so the problem with those genetic risk factors is that there is an abnormal immune response. So it should really be called a gluten allergy, but gluten intolerance is pretty much used pretty widespread. The thing is, it is not just 2 genes that will tell you that you are reacting abnormally to gluten. There is a number of others. We screen for 6 at our clinic, and a lot of people who have only been screened for 2 may in actual fact be gluten intolerant and they simply don't know about it. So if you are using your genetics to screen around this, you want to go in and make sure you're doing some extensive screening. We have done a previous podcast on gluten intolerance, and I would suggest you go back in and listen to that. We go into a lot more detail around some of the genetics and also some of the pathophysiology and the way that the immune system is reacting. But the most important thing is you would want to, if you've been diagnosed with celiac disease or there's a family history of celiac disease, you would want to go in and screen to see whether you are reacting abnormally to gluten, and you need to do it over a number of genetic SNPs, not just those 2. There's also another terminology out there that I hear a lot is what we call non-celiac gluten sensitivity. So we always knew that there were people that were reacting to gluten that didn't have celiac disease. So this is how that terminology came about. We should just let go of that kind of terminology. It's just more confusing than anything. And the thing is that in order to get celiac disease, you have to have more than a problem with reacting abnormally to gluten. You need to have one of those gluten intolerance risk factors, but you need to have a whole range of other genetic risk factors. So you've got to screen a lot more than just around your gluten as well. We know from research there are in total somewhere around 40 to 60 other genes that are playing a role in the development of celiac disease. So yes, you do want to know whether you're reacting to the gluten, but you also need to look more broadly as well. And the reason that it's so important to go in and look and look early is that if you've got gluten intolerance mutations, it's not just celiac disease, it's a whole range of other autoimmune conditions as well. And so this is why if you've got a family history of autoimmune, go in and look really early. But when we look at these additional 40 to 60 genes that are playing a role, what we see is about 15% of those genes are having a really big impact around our neurological health. And again, this is where we've got to be very careful when we're assessing symptoms at a clinic level. Yes, if you're reacting to gluten, it's quite likely that you're going to have a lot of these gut issues, pain, cramping, diarrhea. But there's a lot of people who are highly reactive to gluten who get almost none or very little in the way of gut symptoms, but they may be experiencing anxiety and depression or persistent depression. And again, we know that some of the triggers from the immune system can be crossing the blood-brain barrier, but there's also these other genetic factors. So when we're looking at people from a mental health point of view, we should not be excluding the fact that, maybe we need to be looking for gluten intolerance here, is we've got to see that the body is connected in ways that we just often don't understand. If you've been diagnosed with celiac disease, and in fact, if you've been diagnosed with any autoimmune disease, you're more than likely to have more than one autoimmune disease. So this is why you want to go in and look early. It's also why that if you've been diagnosed with celiac disease is that you don't think that just removing gluten is the only thing that you need to do. You need to be looking across a whole lot of other risk factors and drivers so that, again, you don't end up with having more autoimmune problems. In clinic, the most I've ever seen in one person is 5 autoimmune diseases. If we look at the research around if you have celiac disease, what other autoimmune diseases are you actually more likely to have? So one of them is psoriasis. So psoriasis is an autoimmune condition of the skin. So again, those two can often show up together in the same person, or you might have one member in the family that got celiac disease, maybe someone else that had psoriasis. So you often see those come as a pair. We see that celiac disease can really increase the risk of thyroid disorders. And the most common autoimmune will be Hashimoto's, which is the underactive form, and Graves' disease, which is the overactive form. We see that celiac disease and Crohn's disease are often paired together. Again, it's autoimmune. It attacks the intestinal system, but it's not attacking the villi, it's destroying other parts. So this is why you can have both of them at the same time. But again, often once someone's got one diagnosis, nobody's looking to see whether there's other things that are going on. We see that celiac disease and inflammatory bowel disease go hand in hand. And the other one is around the risk of celiac disease and rheumatoid arthritis. So if you're seeing any of those in the family, just know that it's common to see that, but in fact, gluten intolerance is underpinning the risk of all of those other autoimmune diseases. This can be the power of knowing early and making the right decision. From a genetic perspective, you want to think a little bit outside of the box here. Yes, it's really important to go in and screen for these gluten intolerance mutations. That should be the number one thing genetically that you would be looking at. But we know that the gut microbiome, so this is the bacteria that live in the large intestines, is very important around gut health, but disruptions in gut microbiome, again, can be risk factors around developing celiac disease. We know that there's something called non-secretor status. And again, this comes back to genetics. There's a particular gene called the FUT2, F-U-T2 gene, and it determines secretor status. Again, we have done a previous podcast on secretor status, and I would recommend you go back there and have a good listen to that. But some of you will be what we call non-secretors. This is going to have a really big impact around your gut microbiome, around the vulnerability of your intestinal lining to damage. And we see that non-secretor status combined with being gluten intolerant is a really terrible clinical combination, and certainly is one of the biggest risk factors for the people who are gluten intolerant that go on to develop celiac disease. So you would want to go in, focus on the gut microbiome, and particularly find out what that secretor status is. We would also look at your vitamin D pathway. And again, we've done a very in-depth podcast on the vitamin D pathway. And notice I'm saying pathway. I'm not saying, oh, you need to take some vitamin D supplementation. Your ability to activate, transport, and respond to that vitamin D is all genetic. But you want that vitamin D pathway working in your favor. It is playing a very big role in overall immune function and particularly in risk of autoimmune disease. And it's also playing a really big role in controlling inflammation. And celiac disease and a lot of these other autoimmune diseases, they're diseases that are characterized by too much inflammation. So you would want to go in and understand how that vitamin D pathway is working, be very specific as how you support its function, and making sure that it's not part of the problem, but is part of the solution. You're only going to be able to do that by screening at a genetic level. We know that there's a whole range of other really important genes around intestinal function, intestinal permeability, and intestinal inflammation. And you want to go in and look at these. For every person that has celiac disease, yes, there's issues with being gluten intolerant, but there'll be all these other risk factors, and you want to just be addressing that. If you just remove gluten and think that that's enough, it's not enough. But usually if you've been diagnosed with celiac disease, that will be the only intervention that you will have been directed to do. The other thing to really know is that even if you are gluten intolerant and you've been told to remove gluten, yes, that's important, but do not make the assumption that everything is going to go just swimmingly well because you've removed gluten. We know that removing gluten has a profound impact upon your gut microbiome around the different species in there. Removing gluten can support the growth of certain species. It can inhibit the growth of certain species. And not all of those changes are beneficial. So removing gluten shifts the gut microbiome. The way that it shifts depends on your genetics, and not all of it is positive. So if you're removing gluten, you want to go in and have a really good look at how that might not be working well from a gut microbiome point of view, and being proactive in supporting that. We hear a lot about gut microbiome and diversity, and yes, those things are really important, but the real value of your gut microbiome does not lay in its diversity and its species. It really lays in the metabolic activity of those species. What kind of metabolites do they produce, and how is that going to benefit your health? And this metabolic activity is often referred to as KEGG pathways, KEGG. And when you remove gluten, you have the single biggest change in these KEGG pathways. There's almost 20 of these pathways that will be shifted. Some will be shifted in your favor, and some will be shifted to your detriment. Again, you want to know your genetics is playing a big role in which ones are shifted which way, is to go in and again, make sure that as you've removed gluten, that you're supporting the gut microbiome. And the thing is, most people don't even know that. You can't focus your attention and support something that you don't even know about. So that's the value of, one, having some information, using your genetics to go in and have a look. For any of you who might have celiac disease, have a family member with it, even have a friend with it, know that there's really good ways at a genetic level to go in and look at some of these risk factors to identify whether you've got gluten intolerance issues and to look earlier. What we're seeing too from the research is that they found that if they could identify gluten intolerance in really young children that had been diagnosed with celiac disease, and the younger they were when they removed gluten, the less likely they were to develop a whole range of other autoimmune diseases as they began to age. So again, acting early can be very, very beneficial. But without your genetics, trying to determine whether you are gluten intolerant or not, I think is literally impossible. Trying to do elimination diets and food challenges, they simply do not work because in a lot of people, those symptoms are either not there or they're not obvious enough. And those symptoms may be showing up in ways that you're not even aware of it. If you do genetic screening, screen extensively so you don't miss that gluten intolerance because there's just been too much of an abbreviated look. If you're interested in going down this pathway, again, you can contact us at iDNA Health. We do very extensive screening for gluten intolerance along with a lot of other food intolerances, but we also look at things like secretor status and a lot of the other genetics around gut and immune response. But if you've really been struggling for a long time, try something different, go into that kind of genetic space. And what I know at a clinic level, when people get it right, it can make such a big difference. And, people don't realize sometimes just how, those symptoms that they've been living with years, that when they go, it's just like such a relief. So if you're looking for better insight, please give us a call. Thanks for listening to the podcast today. If we've started to increase your interest around clinical genetics and you think you would like to find out a little bit more, please feel welcome to reach out to us at iDNA Health Clinic. We're proud partners of this Genetics Decoded podcast. It's a real opportunity to get in touch with us and find out how you could go down this pathway yourself. If you liked the podcast, enjoyed it today, please go in and push all the buttons, like and subscribe. It really does make a difference and supports what we're trying to do here. We have a podcast release every Monday, so keep a watch out. All of our topics are around genetics and health, and we would love you to join us every week.